studying. Welcome to the second day of IOC Sports Medicine course. And let me introduce myself. I'm Dr. Meesaq Rizvi. I'm a member of Pakistan Olympic Association Medical and Scientific Commission. When Dr. Waqar, chairman of the Medical Commission, asked me to deliver a lecture on cardiopulmonary response, I was really excited because this is one thing which I really wanted to talk for a very long time, and I didn't have an opportunity to talk on this subject. I've been practicing or training to become an athlete, to become an Olympic athlete over a very long time. And the response I was getting.
Sir, if you don't mind, you can switch off this. I think that would be noise. Listening to you more clearly. You have a loud voice.
So, this is fine? Okay.
Very fine.
Very fine. So I was aspiring to become an athlete, an Olympic athlete. I was just pushed into athletics. I would rather say I was just pushed into them. I was training for hockey or practicing hockey. Let me make something clear between practice and training. When we used to go and play hockey, we were practicing hockey. And the athletes who were playing as hockey players, they would always say, yeah, we're going for practice, we're going for practice. As against that, the athletes who were going on for the track and field, they would always say the word, we are training, and we are training. So they are two separate things. As doctors, we study and then we get a formal training, that is our house job or internship, and then we start practice. Practice is something you have already excelled or achieved, and training is something you really want to build up for the eventual competition or outcome. So there are two different things, practice and training. So whenever I was training, I said I was pushed into athletics like that. I was competing in a hockey trial. My father was a very good hockey player. He wanted me to become a hockey player. So when I appeared in hockey trials, they said, yes, you just cannot appear for that position because a boy is already selected before the trials. I was amazed. The trial hasn't begun yet. So I was amazed. Although I appeared in the trials, but I wasn't selected, I hang up my hockey and the shoes, and the track was next to the hockey ground. And I started running, and I said, look who is winning. And that was the time I decided to switch from hockey practice to athletic training. This is when Dr. Waqar asked me to deliver a lecture on cardiopulmonary response to training or to exercise. I was really very glad, because this is something I really wanted to talk. What is acute exercise and what is chronic exercise? Acute exercise is single session of exercise. As against that, chronic exercise or training is exercise, multiple exercise session spread over days, weeks, months. If we say Olympic, at least 4 years, maybe 8 years. So chronic or response to chronic exercise or aerobic exercise is different as against acute exercise. That is the cardiopulmonary response to acute exercise and cardiopulmonary response to chronic exercise. Say we take example of interval training. Do you know about interval training? Yeah. If I want to train and become an 800 meter, and I report for training on the day one, that is my first exercise session, can I do 8 times with 2 minutes recovery? At what pace? 12 weeks after done my off-season and pre-competition season training, I would start with a very mild or gentle, maybe 12 into 200 meters with 2 minutes recovery, maybe at 32 seconds. That is quite achievable. If I've gone through training and if I've gone through these exercise sessions every week, if we spread this to 12th week, we can still do, and this is quite achievable. I've done about 6 to 8 reps of 200 meters with 2 minutes recovery, 24.5 seconds. But that is after 12 weeks of training, over 3 to 4 years. So every training session should be planned. As coaches, as therapists, you need to have a plan, a training program.
Meesaq.
Yeah.
A Meesaq will be the best. A Meesaq will be the best.
Meesaq would be a good thing. The thing is, we need to train our heart. We need to train our body. We need to train our respiratory system, because it is really difficult to run without training. You'll run out of breath, you'll achieve anaerobic threshold, you'll develop muscle fatigue, your muscle will stop exercising, and you'll stop exercising. So, in order to train, let me go through this boring section now. Boring in the sense, this is really physiology. I can't do much about it. The exercise physiology which is there. So, human physiology is the science of the mechanical and physical and biochemical functions of human in good health, the organs and cells of which they are composed. I'll try to skip and go fast. Respiratory function. Respiration is the name given to the process of breathing. Functions of the respiratory system is to bring oxygen from the surrounding air into the lungs, allow oxygen to enter the bloodstream and carbon dioxide and water to leave the bloodstream. This is known as gaseous exchange. The trachea, the left and right bronchus, the bronchioles, the alveoli, they are the organs of respiratory system. We have nasopharynx, mouth, trachea, lungs, bronchial tree, bronchus, right and left bronchus, and their muscles, diaphragm, the intercostals, from each bronchus into the smaller tubes of the system called bronchioles. At the end of the bronchioles are the tiny air sacs, where actually the gaseous exchange takes place. Carbon dioxide is taken up and the oxygenated blood is carried towards the heart through via pulmonary vein. So, as oxygen is passing from the alveoli into the bloodstream, carbon dioxide is passed from the bloodstream into the alveoli and the carbon dioxide is then exhaled. Cardiovascular system is the term used to describe the heart, the blood, and the blood vessels. That is circulation. Major functions of the cardiovascular system, well, doctors will know, the physiotherapists will know, but I'll just go quickly through this so that the response we are getting in terms of cardiopulmonary training will be evident in every system. Okay? To transport oxygen from the lungs via the blood to all the tissues of the body, that is muscle, skin, major organ, etc. To transport carbon dioxide from all the body tissues to the lung. That's the right side of the heart. This is the left side of the heart. Through pulmonary vein, we get oxygenated blood into the left atrium, into the left ventricle. It is pumped via aorta to all parts of the body, exercising muscles, and blood is returned via inferior and superior vena cava towards right side of the heart, into the right ventricle, and then it goes to pulmonary artery towards lung for oxygenation to take place. The heart. The pressure with which moves the blood around the body comes from the pump called heart. Contraction of the left ventricular conjugated, the muscle wall of this chamber is much thicker than the other. So we got thick muscle wall as compared to this thinner muscle wall. The blood passes through one-way valve into the right ventricle. I've gone through that. So the blood then passes into smaller and smaller arteries, blood vessels, and eventually into the capillaries, the smallest blood vessel. The walls of these capillaries are very thin. This allows water and all dissolved substances to pass through. Therefore, oxygen can be passed to the tissues of the body. Waste products, particularly carbon dioxide, can be removed from the body and tissues and pass into the capillaries. What is VO2 max? And why do we train to enhance our VO2 max? The ability of body tissue to use oxygen is referred to as maximal oxygen consumption, or VO2 max, depending upon two factors. The efficiency or ability of the cardiovascular system, that is heart, blood and blood vessels, and the respiratory system, lungs, to deliver oxygen to the body, tissue or muscle. The efficiency or ability of the body tissue to extract that oxygen from the blood and use it to produce energy. VO2 max is the ability of the exercising muscle to extract oxygen during maximal effort of exercise. It is expressed in ml kg per minute. There are two main components in blood, that is plasma and cells, the red blood cells, the white blood cells, and the platelets. The blood has to pass through two systems within the body, the pulmonary system for oxygenation of blood to take place, and the systemic circulation where the exercising muscle gets blood from the left side of the heart. So they are two separate systems, and the blood moves around the body through blood vessels. There are three main types of blood vessels: arteries, capillaries, and veins. The arteries carry oxygenated blood, except for the pulmonary artery. The capillaries are tiny, thin blood wall vessels where gaseous exchange takes place. Heart. Each heartbeat consists of a contraction of both ventricles. This is called systole, and relaxation of both ventricles. This is called diastole. The amount of blood pumped out of the heart in each heart is known as stroke volume. The amount of blood pumped by each side of the heart with single contraction is called stroke volume. The amount of blood pumped out of the heart in each minute is known as cardiac output. The number of times the heart beats each minute will vary from person to person. Usually it is 72 beats per minute. Stroke volume into heart rate is cardiac output. There are many factors that affect the speed at which the heart beats. These include excitement, smoking, drugs, illness, temperature, fear, body position, lying, sitting, standing, and exercise. Age. So why we are here? We are here to discuss what is the response to exercise during training, or the response of blood pressure. The blood pressure is the term used to describe the forces created by the blood that passes through the blood vessel with each heartbeat. As already discussed, each heartbeat consists of a contraction phase and a relaxation phase. These are the function of blood pressure. Factor that increases the risk of developing blood pressure. I'll skip that. Coronary heart disease is the disorder of the heart or coronary blood vessels. Atherosclerosis is hardening of the artery because of cholesterol. Arteriosclerosis is the small vessel disease. And heart attack or coronary occlusion or myocardial infarction is blockade or narrowing of the coronary blood vessel because of underlying pathology. Stroke, the blocking of blood vessels supplying blood to the brain. Angina, chest or arm pain resulting from lack of oxygen to the heart muscle. Congestive heart failure, the inability of the heart muscle to pump blood at a rate that can sustain life. Exercise is able to improve some of the above conditions. However, it is essential that anyone suffering from heart disease seek guidance from their general practitioner before beginning any exercise program. Cardiopulmonary response to training. How does the cardiovascular system and respiratory system respond to exercise? What happens to the heart rate? The effect on stroke volume, the amount of blood pumped per heartbeat, the impact on cardiac output, the amount of blood pumped by heart each minute, systolic blood pressure, what happens in response to the cardiorespiratory system, the breathing rate, and the effect on VO2 max in terms of short or acute exercise. Coming to the long-term effect, the training effect. After regular exercises, maybe minimum of 3 times per week, jogging exercise such as walking, jogging, or cardio exercise between the ranges, I would mention it. Exercise to music classes, the body begins to adapt to the demands that are regularly being placed on it. These adjustments that the body makes are called the training effect. The training effect on the cardiovascular system, the heart, the blood vessels, and the respiratory system following a regular training, aerobic training. The heart muscles becomes thicker and larger, particularly the muscles of the left ventricle. The thing what happened is if I started with a slow cardio exercise like this, maybe I'm doing 200 meters spread over 12 weeks or 14 weeks. So I would start with 12 or maybe 200 meters at a very slow pace, and I will gradually decrease that to 31 second, 30 second, 20%, 80, 95%. Because my best time is 24 seconds or 23 seconds. So I'm running at 25 seconds, so I'll just do 1 or maybe 2 reps. So you need to be very careful what heart rate and what should be my heart rate after 2 minutes of recovery before I begin another exercise session.
What's the condition?
Yeah, it depends upon the condition. But what should be before I can begin? Otherwise, I won't start the next session or next training run. So what should be? Normal, should it go to 72 beats per minute? It will take ages. So what should be the minimal we should really start with? It should be 120 or less within 2 minutes. Because after warm-up, my initial heart rate was 72 beats per minute. Maybe it goes to, after warm-up, 100, 110. Before the start of this first 200 meters, my heart rate was 120 or less. I ran during the course, my heart rate reach 180 because I'm not running 100%. It is a controlled, sustained effort, and my heart rate is maybe 160, 170, maximum 180. So I'm not running 100%. I'll walk back or jog back. Before the start of the next session, my heart rate should be 120 or less. Because if it is 140 or 160, then I have not recovered. Muscles and my heart have not shown enough recovery, and I may not be able to sustain this exercise for very long time. Maybe 6 sessions of 200, 6 reps of 200. So with good sustained effort, you can train and build your left side of it. And that is what training really does with you. I was doing this training ages ago, 1980s, and I was using heart rate as a tool to assess my second round. I would just check my pulse and start training. We got very sophisticated method of measuring heart rate now. We got Polar, we got rest of the heart rate monitors. You wear a belt and it can be displayed on the computer. You've seen cricket players. Before the start, they're bowling. During the fielding, their heart rates are displayed on the screen. That is on the channel. How is it possible? This is through sensitive technology, and that really shows. If you're using it for hockey players, we can check whether they have recovered or they are doing at 180 beats per minute. There is no harm if your heart rate goes to 190, 200, even 210, because I have achieved heart rate of 210 also. It's how sooner you recover. That is important, and that is what training is. So you need to really train your body to become a good athlete, and it is how sooner you recover from that single burst of exercise. It can be hockey, it can be football. You sprint and then you come back. You sprint and you come back, and you keep on jogging. A football player can really sustain that for 90 minutes or so, but with good training. The thing what happens is they do it for 60 minutes, and the last 30 minutes they are just jogging around. They're not sprinting. And with good exercise program, you can really develop their cardiorespiratory endurance. Because if they are recovering, they'll go back and sprint again. The thing what happened is our hockey team is losing just because during the last 10 minutes, they're fine for 60 minutes. But during the last 10 minutes, they're not really coming back because they're fatigued, their heart is not pumping enough blood, their heart is already on the edge, they're excited, their heartbeat is 180, 120. If you apply brakes, sudden brakes, in response, maybe a cat crossing or a dog in front of your car, your heart starts pumping. Maybe it will reach to 180, 120, 200 beats. That's because of the effect of catecholamines or adrenaline. Same thing will happen if your heart is pumping and you are excited, you're bound to make mistakes. Your accuracy level goes. So the ball will go wide. The thing what happens with hockey or football players, they'll start kicking, they don't have control. If they are really doing it at 150 or 160, then it is still under their control. So the heart beats more slowly at rest. So do you know how to check your heart rate? It's very simple. Put your hand on your pulse, count it for 6 seconds, and then multiply it 10, factor of 10, or maybe count it for 10 seconds and multiply it with the factor of 6. You'll get your heart rate. It's very simple. When I was sitting in the classroom and measuring my heart rate during my training days, when I was training for the Olympic Games, usually was how much?
40, 50, 25.
Yeah. I measured up to 48, 44 in classroom, or resting heart rate was between around 38, 39. resting heart rate is the early morning heart rate. When you get up first thing in the morning for 3 consecutive days, you check your heart rate. That is your resting heart rate. So I measured my resting heart rate to be 38 in the morning. Or like sitting in the classroom, I usually put my finger on my heart rate and count it a full 1 minute also. It was around 44, 48. Usually it was 44, 48.
Was it natural or you trained it?
You train it, obviously. You obviously train it, but you need to train. Because if you're not training in a proper way, your heart rate will keep on rising. That's what happened with congestive cardiac failure or patients with heart disease. The heart rate doesn't come down. Yes.
So what about the carotid pulse?
Yeah, you can take carotid pulse. Yeah, you can take pulse from anywhere. Yeah. Usually immediately after the exercise session, you check your heart rate for minimum duration of time. That is maybe 6 seconds or maybe maximum 10 seconds or 12 seconds. 12 seconds you run to because the moment you stop exercising, after maybe a minute, your heart rate, the last half may be getting better and slower. So you need to, in order to get your true heart rate, it should be immediately post-exercise. Immediately. Maybe 6 seconds, maybe less. So maybe for 10 seconds, maximum 12 or 15 seconds. Because if you count it for full 1 minute, the later half of that 1 minute may disturb or may not give a true value of your heart rate. But for resting heart rate, that's it. Yes. What is the cause? This is because of increased vagal stimulation. Vagus nerve controls the heart, that is parasympathetic. So with good training, your parasympathetic nervous system gets stimulated, increased vagus tone will slow down your heart rate. If the stroke volume, then there is an underlying pathology. Maybe because of the rheumatic heart disease, your stroke volume is not going to get up. Your cardiac, there is enlarged or cardiomyopathy, but that is not ventricular hypertrophy. That is not in trained athletes. That happens in patients with heart disease or valvular disease, I would say.
So that means the stroke volume increases over the period, isn't it?
Yeah, it increases with training. Yeah. Stroke volume increases with good regular aerobic training.
Excuse me. Isn't it that when you have the training athlete would have cardiomegaly all over, and just to understand, and if there is an underlying pathology, then there would be a left ventricular hypertrophy. That's the difference between the two.
There will be cardiomegaly in both cases,
Yeah.
but the thing is, ventricular hypertrophy with thickened wall and ventricular hypertrophy with thin wall. That is the only.
Yeah, that's also what we say the pure physiological.
Pure
Yeah, both of the conditions can happen in heart disease.
Yeah,
Suppose if there is a pressure, the aortic stenosis, there will be a ventricular hypertrophy.
it will be up to a limit, and if it continued for a long time, then there will be cardiomyopathy along with thinning of the left ventricle.
That will be in a regurgitation. There will be a balloon.
Yeah.
There will be a dilatation of the
Dilatation.
wall, and that in that case also it cannot form.
Yeah.
But in the epilepsy, it's a pure system.
Pure ventricular hypertrophy.
Without any pathology. So that
Yeah.
we can form.
That's right.
Sir, if an athlete has a normal heart rate, so it will be further after doing continuous exercises every day, and it is a regular athlete, and still his heart rate, resting heart rate, in the daytime, is what it shows.
It shows he's not training. He's just practicing. He's not really trying to build his cardiovascular system.
But it's if it is in a group format, like in a
Yeah.
football team,
Yeah.
and
It's
the
very
training
difficult.
Training is in a group form.
So he needs to train a little more at a slower pace. So he needs to work really hard. Even after the training session has finished, he needs to really build his cardiovascular system.
We should go for the
Endurance training, very
And,
slow.
Another question: if an athlete has stroke with a 60 beats per minute, normal resting heart rate, Can we assess his recovery time during the maximum training session? What should be the recovery time for his heartbeat?
Recovery time, if it's a 60
after
minutes.
after a 100-meter sprint or after
Yeah.
a 60-meter sprint.
It should be below 120 or less
Below
before he
120.
starts another sprint session. At least 120 or
60,
less.
you mean 60 is a good heart rate for an athlete?
For a good endurance athlete, it should be below 50.
Below 50.
Below 50.
Right.
For a good footballer, it should be around 55, 52.
56, 57,
Yeah.
that goes.
But if you're very good, if you're competing at elite level, then you really need to train. The thing with Cooper's test or what
League.
footballers do is
Excuse me. Could there be any difference in between a 100-meter cleat and the 1500-meter cleat, distance cleat?
yeah, they're different. They are training the anaerobic threshold.
So what? Okay.
Yeah. They need to train
Okay.
aerobically as well as anaerobically.
Okay.
For a 1500-meter runner, he needs to train more aerobically.
Yeah.
There is anaerobic threshold where heart rate reached beyond 90 or greater.
Okay.
But with good recovery, maybe 6 minutes, 7 minutes, he can still start a new exercise session of 100 meters. And if he keeps on doing it below 120, then he will be fatigued after third or fourth run. So for a 100 meter, he needs to train and build his anaerobic system rather than aerobic.
Should we assume that training would give us 100% targets?
Yes, proper training. It's not training.
Or does it depend on the individual anatomical and genetic?
If it is proper training with good assessment and proper training program and with good response to exercise, measuring and assessing athletes on regular interval, doing fitness testing, doing body composition, proper diet, then they can achieve their target. But there are few limitations in terms of genetic, age, obviously. There are many factors.
Because that
Facilities.
was my next question, that a person aged 50 and above,
Yeah,
given the same program,
yeah.
would give you the same results.
There are few limitations.
There are
It can be genetic also. It can be born also. Athletes are born, sprinters are. Yeah.
Two different types of
Inbuilt.
fibers. So normal blood pressure for an athlete.
The lower the better. It should be 110 or 70 or below. But the normal ranges are the same for all the population. So the training effect. The training effect on the cardiovascular system, the heart beats more slowly at rest.
7, yes, okay. 7 is okay. Yes, yes.
The heart recovers more quickly following exercise with good training. The heart becomes more efficient. It pumps more blood with each heartbeat, stroke volume, and consequently more blood come out during each minute. There is increased efficiency of respiration. This means that an individual is able to take fewer breaths to move the same amount of air in and out of the lung. The alveoli, the tiny air sacs in the lung, increase in size, and there is an increase in the number of capillaries, that is tiny blood vessels in their wall. This means more oxygen is able to get into the bloodstream, and at the same time it is possible to remove more carbon dioxide. There is increased capillarization inside the muscle fiber also, as well as in the lungs. So the gaseous exchange is more efficient. The arteries become more elastic. These are the effects, the training effects on cardiopulmonary system or arterial system. Improve their ability to narrow and widen. Consequently, they become more efficient, allowing more blood to move around the body. This may help lower the blood pressure, so enhance the recovery. The volume of blood increases and more red blood cells are produced. Red blood cells receive oxygen from the lungs and carbon dioxide from the body tissue. This means that the blood becomes better at carrying more oxygen to the muscle and better removing carbon dioxide. The number of capillaries, tiny blood vessels, increases in the active muscles. This means that the delivery of blood and therefore oxygen to the muscle is improved. At the same time, it is possible to remove more waste products. The VO2 max increases, i.e. the amount of maximal oxygen uptake by exercising muscle increases by 5 to 30% in as trained versus untrained athletes. So if somebody has a VO2 max of 40, it may go up to 55, 60. That is almost 30%, 40% increase. There is more increase untrained. This is more increase in untrained individuals. Women also shows increase in VO2 max as compared to man, but because of the body size and size of the exercising muscle, they may not show that much improvement. But still, comparable to men, they also show improvement in response to aerobic exercise. Chronic endurance exercise recommendation. These are the recommendation of American College of Sports Medicine. Frequency should be 3 to 5 days of week. Intensity 60 to 90 minutes of heart rate maximum, or 50 to 85% of VO2 max, and duration minimum 15 to 60 seconds, 15 minutes to 60 minutes. The art of aerobic exercise is really amazing. What we have been recommended over here and almost 1400 years ago. The thing what happened is when we go for Umrah or Hajj, Hajj is a marathon I would say, but for Umrah, the thing what happened is we do a 7-lap warm-up at a very controlled speed, and then we start from the top of Safa hill, then we go downhill and increase our heart rate to maybe 60 or 70%. Do a little bit of jogging and do an uphill run or walk. And we turn back and do a similar run for 7 times. Once we have done that, that is approximately 2.8 kilometers. So for the first 400 meters or maybe 600 meters, we do a warm-up around Kaaba. And then we do a 2.8 kilometer runs in maybe about 30 minutes. And once we are finished, we go and take water. We don't start eat anda or egg whites. Don't eat that. So we take water, that is part, and then we do a cool down. That is amazing. That is the recommendation American College of Sports Medicine has given. Maybe the people living over there were doing it at least 3 times per week or maybe 5 times per week, Umrah. And they were doing it for 50 minimum. You can do Umrah if you're doing very fast, maybe in 20 minutes. And maximum, even if somebody is very old, they'll do that in 60 minutes. So this is amazing. That's how you increase your intensity or exercise. You can improve your stamina, and that is minimum requirement for everybody. That is the similarity which I have found from my own personal experience. And you must drink water. That is part of it. After you have finished your 7 laps of 400 meters, and that is approximately 410 yards. Amazing. So the French who designed this athletic track of 400 meters, they've probably gone and get this knowledge from over there. So the basic unit is 400 meters. Anything over 400 or less than 400, the basic unit is 400 meters. Yeah, you can take it. Yeah. VO2 max can be done in laboratory setting. We can have indirect methods of field tests, like Cooper's test, and we put that value in a or you can do an indoor Rockford 1 mile test on a treadmill or maybe on a flat level surface. So there are equations available, there are tables available. So we can directly do that in a laboratory, VO2 max, or indirectly we can do field test, and comparable results can be found on tables or charts. Acute strength training response. They are response of cardiovascular system to the method of performing. It depends upon the method of performing strengthening exercises, influence cardiopulmonary response. Factors are type of exercises, the isometric, the isokinetic, or the isotonic. It depends upon size of the muscles, the number of reps, load and rest period between the sets. So it all depends what is the response depending upon these factors. It increases heart rate and blood pressure with minimal increase in VO2 max. So strength training may not increase your VO2 max. Stroke volume remains unchanged or decreased. How is it possible? Why stroke volume increases or decreases as compared to aerobic training? So heart rate increases, the stroke volume should also increase. How? The stroke volume increases because in strength training, when you are lifting, your glottis is closed. Because of Silva maneuver, your diaphragm contracts, the venous blood flows decreases. If the venous blood flow decreases, your stroke volume will eventually decrease also, or it remains unchanged. It's not because heart rate increases, it should really improve. Because of this forceful contraction, it may increase your cardiac output. If your cardiac output is not increased, this means the stroke volume is not increased. Isometric exercise produces large increase in blood pressure. So in patients or in people who have tendency to have heart attack, they should restrain from doing massive isometric training or slow reps, high weight. Decreases in blood flow because of contraction. Because muscles are contracting, the arteries are also inside the muscles, they get contraction. There's tremendous increase. It can be tremendous increase in blood pressure during strength training, single exercise session. Or acute strength training response. The heart rate response is affected by intensity and number of reps. If you're doing low intensity, maximum reps, that is aerobic, the heart rate response may be different. Single maximum contraction produces lower heart rate response versus high intensity contraction. As compared to that, if you're doing 1 rep, doing heavy intensity, more reps, the response should be decreased. Chronic strength training response depend upon strengthening protocol, depending upon how good your trainer is. If your trainer is good, then you can give positive response, even with strength training. But usually, the scientific evidence, a variable resistance isotonic program lasting 16 weeks produces no significant cardiopulmonary adaptations. There may be minimal improvement, but not significant. However, long-term resistance training and circuit training program may produce moderate changes in cardiopulmonary. So, circuit training may be an option in between strength training programs. The method of performing strength training exercise influences cardiopulmonary responses. Factors are type of exercises, isometric, isokinetic, size of muscles. I'll finish my lecture and I'll open for question answer. Thank you very much.
And what are the measures to overcome?
Measures.
We have been doing,
it should be supervised training session under a qualified sports trainer.
Little areas, more than
50. They should always do training under a supervised trainer. So good trainer will help prevent injury. Serum lactate test will prevent the endurance level of the athletes. The idea of aerobic training is to delay the onset of lactic acid. So anaerobic training